Hello. Hello,
Uh,
Dr. Fiyonika. How are you?
Hi, doctor. How are you? I'm fine.
That's great. I was trying to join, but I think your connection was not proper or something like that. So it was not showing.
Yeah, yeah. It happens like whenever we do this live things, थोड़ा technical हो जाता है. Many
Yeah.
times for us it's very technical, ना? We do it very less. Never joined anyone, so it happens.
Yeah. So, what are we going to talk about? Pregnancy.
Yeah, we are into pregnancy just like you. You are into more thing like more of the I can say the anatomical part and other things, and I am into like the holistic things where female needs more of support and what kind of knowledge we should provide because the scenario have changed since like 2-3 decades. So now I feel the whole approach has become more holistic.
Yeah.
Our roles as a female have also changed. So
Yes.
I try to include that holistic things
Yeah.
and
That is also very
maybe
important in today's world, actually.
yeah,
More than the
yeah,
medicine, this works, actually. It works in many
yeah. It
problems.
actually works. I have seen. Yeah. So our session has already started, or like you are still going to start and cover
No,
the
it's
like the
already
main
started now.
query.
Now people must have joined us, so we should come
Oh,
to our subject.
okay. So maybe you would be taking the session like the queries, common queries we would be taking maybe in the session so that
Yeah,
जो जब भी प्रेग्नेंट होते हैं बहुत सारे क्वेश्चंस होते हैं आपके पास तो आते ही होंगे मेरे पास भी ऐसा
yeah,
ही होता है there are
yeah, yeah.
and first time pregnants have too many things and I feel they should be addressed. Yeah.
So, just wanted to know from you what type of patients you get more related to pregnancy. Like, what problems do they come to you with?
Usually, there are no as such problems. Nowadays, females have become more aware. So they know this that the kind of hectic routine and like work-life balance along with managing pregnancy. So what they seek is somebody who assists them throughout the pregnancy, whom they can look up for like their common queries. Along with that, uh, they want to do activities which actually channelizes their thoughts towards positivity. It can be in the form of yoga classes they attend and the Garbh Sanskar activities they do. So they approach by their own also nowadays, and many a times gynecologists are nowadays suggesting that you should go for some kind of antenatal care apart from what is going on here, apart from the regular checkups and scan which they go through. They want some more out of that. So people approach me out of curiosity sometimes ki hota kya hai. First they want to understand, and then once they understand the concept that yes, this things actually works, so then they join. Sometimes they join for uh, like the whole pregnancy or from the time they start. Some starts in the second trimester, some very late, but whoever joins they feel like it was worth it.
Worth it, yeah. Actually, they
Yeah,
need to be made aware. Actually, they need to be made aware that this also can help. The problem
yeah,
with us, with our culture, is that mother-in-laws and sister-in-laws do not tell the patient that okay, if you are having some emotional problem or you are not being able to cope up with that, they will only take the ladies to us. They will only bring the ladies to us, and then all these problems can to an extent be helped with the help of medicines, but some psychological counseling in the form of some yoga or meditation or just talking to them by a counselor helps them a lot. So I feel that every antenatal clinic should have a counselor who talks less about medicines and more about the thought processes which are in the mind of the women folk. So that is very important.
That is a good thing to hear from a gynecologist,
Yeah,
because now, like the mental health actually impacts, no, like our whole body and the baby developing inside. So, if still in India, what I feel is the people feel more connected, or they actually divert towards anything else once their doctor permits. The good thing you told, that you suggest, or you maybe in your place you are including it for a,
yes,
like better results. And when we give it a try, na, I have seen always positive results. So it's very
yeah.
nice to hear from you that you think so, and you like you are promoting this.
Yes, yes. What I think is that if the lady goes to a counselor also, so making the things understand to them is a bit easier for me.
Yeah,
That these symptoms are the normal symptoms which are in pregnancy. They keep on crying, even if they have conceived after a lot of treatment, no, then also they will complain about those first trimester symptoms. So sometimes you
yeah,
just feel that you just tell them that you wanted this pregnancy. So now you have to accept some, they want that
yeah,
every problem should become normal. They do not understand that there are normal physiological changes in pregnancy which are going to happen, and they can be relieved to some extent by the help of medicines, but they cannot be corrected fully. So it is very difficult for me to explain them. But if somebody gives them a psychological support, listens to their problem by giving them 20-30 minutes or so, then it is a sort easier for me, a lot easier for me.
yeah, it's good. Whenever you are aware about anything, it's always good to hear. And sometimes pregnancy starts for everyone like this only. Whatever, however, you have prepared, once you actually get pregnant, because of the impact of the hormones or the things happening inside, there are so many things happening inside the brain of a pregnant female. And they want somebody to hear it, and they actually want somebody who can make them understand that it's very normal. Nowadays, we consider the pregnancy as a very big task. It's a very natural thing, for which nowadays girls get very tensed. Either they are like, whichever age group they are, whatever they do, they are prepared or unprepared. I have always seen mixed emotions, and when they talk about it, and when I just do the whole sessions like nutrition or like breastfeeding or labor and how things happen, the trimester wise psychological physiological changes, so they feel very good, like okay, it's normal. Once they understand it's normal, it's very easy for them to accept and go with the flow and enjoy. Actually, pregnancy is more about enjoying the whole 9 months.
Yeah, that is
Yeah.
basically a very beautiful journey. If you see that you
Yeah,
are doing such a noble job, you are in the process of creating a human being as you are.
yeah,
So this
yeah,
is a thing which a lady should think, that she is blessed to have this privilege
yeah,
of giving rise to a newborn, to a new being. So they should feel happy about it. And the thing is that they feel that they have some problems, and we also should not treat them like, it is said that a pregnant woman is not a patient, she's a pregnant
no,
lady. So
no,
we should
yeah,
always consider that this is a normal thing, that this is going to be over when once you progress in your pregnancy, or you reach delivery, or even after delivery some things go like that after that also. So there is a question from somebody. The person is asking, after how many months should we conceive after missed abortion? So the answer to this question is that after a missed abortion, if the abortion is the first abortion, or even if it is a second abortion, then it is necessary to just wait for around 3 to 6 months. But if you are having recurrent abortions, then you should give your body some time. You should go to the doctor. You should come to us, take some help. We will get some investigations done so that we can find out the cause of missed abortion. And only after that, we should plan a pregnancy, like after 6 months to even after a year, after correcting all those problems. Missed abortion can be because of many causes, as simple as having a small thyroid problem, or it can be some chromosomal problem also, which can give rise to this missed abortion. So we generally advise, if the lady has had only one abortion, then we tell her no, no need of any special investigations. You can go ahead after 3 to 6 months. But if you are having recurrent abortions, then you should give your body some time, maybe 6 months to 1 year, and only after getting proper investigations done, then only you should conceive in medical supervision.
So, should we talk about something about yoga and Garb Sanskar activities, which I usually suggest? I would just like to tell something like everyone who have joined about what Garb Sanskar is. That's like the thing I usually do. So, as the name indicates, Garb Sanskar is actually enhancing the quality. Sanskar means it's not always good or like great. Anything, any quality, whenever we enhance, it's called as sanskar. Yeah, and when we do it for our garb, means the baby developing inside the mother's womb, it's known as garb sanskar. And this is a whole program which considers like keep pregnant female happy, healthy, calm, and relaxed, along with channelizing her thoughts towards to bond with your baby, along with making a positive impact on baby's personality. We all know that we actually inherit many of the traits from our parents. We always say na that ये मम्मी जैसी है और पापा जैसा है. What all this indicates, yeah, there is something which the baby actually inherits, yeah. So when we do Garb Sanskar activity, what we try to do is we enhance all the good qualities, what we want to have in our baby. So it includes a lot of activities like meditation, there are breathing techniques, relaxation techniques, positive programming for the pregnant female, yoga, pranayam, along with a whole 9 month diet regime. As Ayurveda have a whole detailed explanation of how a pregnant female should conduct, what's her eating habit should be, how she should be taken care after delivery. So we share actually what kind of nutrition, what kind of regime Ayurveda suggests. So nutrition is also a part of Garb Sanskar activity. Along with that, music. Music is a very important part of Garb Sanskar. Then there is affirmations, like we ask you to actually speak about like positive notions to self, then talking to the baby. That is also called as Garb Samvad, as we know that the baby starts, like the ear develops after 16 weeks. So all these activity actually keeps you more calm and connected with the baby, along with feeling happy, and a sense of well-being is created. So Garb Sanskar is not just for the baby, it's mainly about you. The pregnant female is also the person who is taken care during Garb Sanskar activities. So in any form, when you do it, like in a regular day-to-day life, you see a significant change in your behavior, in your emotions, feelings, and in your productivity and working capacity also.
How much time should a lady who is pregnant give in different trimesters of pregnancy to just get the benefit of this Garb Sanskar program as a whole?
Up like starting from 15 minutes to 60 minutes is enough. Like if we just talk about any activity, like we can just demarcate activities in like 10 to 15 minutes per activity. So you can't do all the activities in one day, because on some days you would be feeling like listening to some music. So these specific kind of music which have positive impact are shared with you, so you can listen to music. You can make a routine also, which I suggest, like start your day with mantra chants, then do 10 minutes of deep breathing, then some pranayam. In case you don't have a whole stretch of 60 minutes, you can just make a routine that half an hour I will devote in the morning and half an hour at my bedtime. And in general, it's not like you have to sit at one place and do, if you are in a commute, whatever, like if you drive or you take any transport, there you can do activities which actually, because many things like deep breathing is a thing which you can do at anywhere. Yeah, if you are working or you are a homemaker at any place, whenever you get some me time, you can just do these activities. So there is no specific criteria that how much you should do, but yes, if you have at least 15 minutes, you can start with, and then you start enjoying these activities after a while, and they become a part of your routine. So then you can devote up to 60 minutes. I
And
usually do like that. Like one session is for 60 minutes and it's enough, more than enough.
yeah, very nice. So even if you are traveling or even if you are going to your office, you can just here do
Yes,
that, and that time will be
yes,
utilized for such a nice activity which is going to help you as well as your fetus. So
yeah.
do you remember in your practice that a lady came to you in too much of agony, and when she was introduced to this, then she found it very useful? Do you remember any episode like this?
Actually, I had a pregnant female who was having triplets. So there was not such a kind of agony or anything, but she was alone. She was not here in India. She was away from her parents and in-laws. So she tried to remain calm, but you can understand just a pregnancy can create a lot of
Problems.
changes in the thought procedure. And if you are carrying triplets, and it was very natural, okay, they have not planned for anything, and it was by God's grace she got triplets. And eventually, when she got to know about this, so she just came in contact me in her fourth month of her pregnancy. And after that, when she used to take the sessions, there was some problem in managing the timing also for her. But she used to manage. It was very early for her. She was in Boston. So she used to manage, okay, ma'am, we will do it. I am a early riser, so we can do this at 7 a.m. also. Whenever I start my day with these activities, I feel very good. I am now at peace. I feel that everything is in our control and which are not in our control, I have started accepting it. So her whole thought procedure was good and she felt very good. Initially, since she started with alternate sessions a week, then she started enjoying and then she went for regular sessions like weekly 6 times she was connected with me. We used to do light stretching also because she was not allowed to do yoga and other things. But yes, we used to dance on some light tunes, and she used to enjoy the session with when she used to do deep breathing. And when the months progressed, she could feel the movements and everything. So I have seen these kinds of experience also that they how they feel very happy about themselves and how their whole like the fear actually goes because some things are not in your control.
Control, yeah.
So she was very fearful that how I what will happen, and I always try to counsel that this is not you planned for, but yes, because it's there. Once you start accepting it and try to prepare yourself, you will feel better. And she just followed all my instructions that I should do affirmations about that I am strong, my babies are healthy. Yeah, I am healthy. She used to chant this regularly. So, what happens when you are repeatedly chanting something, your subconscious and conscious mind gets trained like that. Whenever I say anything, a lot of time that I am strong, I start believing that, and eventually I will act like that. So,
Yeah.
the same thing happened with her. So this is one incident I just remember, and there are many actually because every pregnancy is unique and everybody shares a different kind of experience with me. And when they share that good news, so I feel very happy.
Yeah.
Yeah,
These small lines that I am happy, I am strong, I am powerful,
yeah,
these are actually
yeah,
called affirmations. So
yeah.
these affirmations, if this I have also, experienced that being a doctor and being a person who is too much connected to science, no, there is no science
Hmm.
behind that. You will say that thing, and that is working as an affirmation, and that thing will happen. But many things I think is that cannot be explained scientifically, like
Yeah,
our science cannot explain these things. We only believe in medicines, we only believe in doing
yeah,
something good to have something good. But even thinking positively as a positive affirmation, this also helps, that by as you grow, as you age, then you understand. So there is one more question which have come. The person is asking that does prolactin, hyperprolactin levels in your body, hormone is prolactin is a hormone, does this high hormone level of prolactin causes miscarriage? So the answer to this is that it generally is not a reason, not a major reason for a miscarriage, but yes, for infertility, for having problems in conceiving, yes, it is a factor. So these hormone corrections need to be done if you are planning a pregnancy, if you have had miscarriages, recurrent miscarriages earlier, or even if you have recurrent abortions also. This is a test which we do, but it is more likely to cause infertility than to cause a miscarriage. So my next question to you is like, do you feel that all these things also help in the patients trying to conceive if they are having some infertility problem? Does this thing, uh, this helps, the positive
Actually,
affirmations?
yeah. Yeah, positive affirmations also. And as a Ayurveda doctor, what we have a whole program called as Beej Sanskar. Beej is like seeds, yeah. So the for an embryo to grow, the seeds come from like both the parents. So what we do is a whole 3 months program where the both the partners go through detoxification. If you have heard about Panchkarma, it's a whole
Yeah,
uh, 14 days therapy in which the body goes through a detox where all your doshas actually get balanced because we work on the theory of Vat Pitta Kapha. So we suggest a whole detox and rejuvenation program and then a certain kind of diet and lifestyle changes. Nowadays, maximum couples which come to me, they don't have any um, uh, like medical issues, but they have a problem in conceiving. I have seen it's not considered like in infertility also we do Uttar Basti, that is like administration of medicated ghee through the vaginal route, and these also have I have seen results like for many patients of infertility or who go simultaneously along with me, they are trying in some like other way to conceive. And when you actually go through this, when and you follow a certain kind of diet and lifestyle plan which makes you physically active, you follow a kind of routine like diet and lifestyle and sleep. Yeah, many a times we don't consider these as a health issues that okay when we skip meals sometimes we are very late in sleeping, we are not physically active, and so, there is no like reports which suggest that you are medically ill but still you are having problems. So these kinds of programs actually help, and affirmations also help. So in Beat Sanskar, when you plan this 3 months before you are planning, so I have seen 4 to 5 couples like in past 1 year who have been trying and not having any medical issues, and once they went through this whole procedure, the conception was easier. Like once this 3 months like are done, then they try, and within 6 months to 1 year they have naturally conceived. So this actually makes impact.
Yeah, the thing is that being having some problem in conception can be because of some medical issues, like the patient can be having ovulatory disorder, like she must
Yeah,
not be producing as many eggs as required in a year. She must be having some hormonal problem, or her tubes might be blocked, or her husband's semen might be not up to
yeah,
the mark, the motility or the morphology or the count may be less. But apart from that, a major chunk of infertile patients land up into infertility because of stress. This
yeah,
stress can be relieved, and this stress, if relieved, can cause, can give help in conception, can help in conception, and can even help the medicines to work better. So,
yeah,
stress relieving, I have felt that in my practice of around 20-25 years, I have seen that a lady, a couple who is coming to you, if the couple is having full faith in you and they are not
hmm,
too much into checking everything you say, everything you write on Google, and they are having total faith on you, that means they are not in stress, they are believing what you are saying,
yes,
they conceive better. But if
yeah,
the couple is having too much of queries in his mind, that they are, it is very apparent once you talk to them, the thing becomes very clear that they are so much stressed. They are the people who have lesser chances of conception, and they might be suffering from infertility for many years, and they are the people who need this counseling, this therapy, these help in affirmations and all these things, whatever programs you are offering, they are the most in need. So these couples should be referred for this function so that the treatment becomes easier and it doesn't take too much of time. That is what I feel.
And stress has become, I think, a very important part of everyone's life, knowingly, unknowingly. Whoever is staying home, also like kids, also of 14,
Yeah,
15 years, are stressed these days. And whoever is into many kind of multiple things, whenever you get into multiple things, automatically there are kind of stress,
yeah,
sometimes due to the environment in which you work, sometimes the family in which you are, or anything, like sometimes it's about finance or work or family or life. So stress management is something that I have seen. When stress is not there, no, healing is also very fast whenever, or any kind of in general, overall health is also good, I feel, whenever we are stressed out. So I don't know, the whole mood or like feelings of not feeling fresh in the morning. I have seen this like past year in Corona, that how we used to feel depressed, and now when the things are normal, how we start getting into a normal life. So stress, when omitted from our life, we work and function very well.
yeah, yeah. If
Yes.
you have a good routine, like if you are getting up in the morning, going for a
Yeah.
walk, going for a run, going for a cycling, that day you are more fresh
Yeah.
than when
Yeah.
you are waking up late and you are just being lethargic. That day your total work which you do on an active day is more. So the mind, the thinking which is going on in your mind is very important. So you need to hear such good things so that it helps you in your daily efficiency, also improves, it increases. So
Yes.
then there is one question that um how the hormones level of thyroid can affect pregnancy. So the answer to this is that thyroid is again a hormone which is important for your conception, like it is important for pregnancy. And once you are pregnant, the hormone level in the early parts of pregnancy is more important, because if it is not corrected, if the thyroid level is very low, the TSH is very high, that means then there is a suspicion that the fetus which is inside your womb will be mentally not developed properly. The intelligence will be affected. So this is the first hormone which we generally test once the patient comes to us, once the lady comes to us and tells us that she wants a pregnancy or she has just conceived. That is the first hormone we look up to. So this hormone is very important for your fertility, for the general well-being of the lady as well as the fetus. And it can cause hypothyroidism, can lead to infertility as well as abortions. So it is very important to control this hormone once you are wanting a pregnancy or you have just conceived. So do you just let me know that do you encourage exercises also in your third trimester? Do they really help in some ways for a patient who is about to deliver?
Yes. Like not, I'm not much. I have like a specialization in yoga, which can be done during pregnancy safely during the whole second and third trimester. And I have like females who have done yoga till their last like day, when they are into contraction also, they felt good, because eventually when you are regularly doing this along with breathing techniques, yoga comes with pranayam together. And when you have the charge, when you can regulate your breath, so you have a better control over the pain management. So the labor is all about managing that pain and the whole stage, along with when you are physically active, means you are walking or doing yoga or any kind of exercise, whatever we are suggesting, it is gradually preparing your body for a smooth labor. Many a times you don't enter into a normal delivery. Maybe sometimes you are in a C-section also. But if you have done any kind of physical activity, I have seen you bounce back really very fast to your
Yes.
pre-pregnancy condition. Your muscle tone are better. Like you don't
Yes.
have that sagginess. Yeah, it's very important. Like you can lose weight, but what about the muscle tone? Yeah, and the same about the evolution of uterus, the same about the healing. You need a lot of healing because this whole 9 month journey actually doesn't come to the end after this 9 months. You have much more to go, and now you have somebody else also to assist. So it helps actually in a better healing physically and mentally. Many times when I see the things like depression after like having the delivery or getting difficulty losing weight. I have seen whoever females who are physically active, they feel happy, they bounce back easily, they have a better energy level. They don't feel like they are into a fatigue or no energy or exhaustion. So it really makes, and it actually makes the labor also smoother. I have seen because the pelvis is open. What all these yogasanas do, because our body is doing its own job. We are naturally made like that, that during this 9 months, our body secretes the hormones in which you are naturally prepared to give birth in a natural way, unless there are any other circumstances. So when you are doing this specific yoga, I have seen the head engagement better. There are asanas which we do, especially in third trimester. That too, like the way of, there are different types of squats. There are different kinds of like cat cow pose which we usually do in the 9th month, and they have really like the breech baby also rotate, and then there is a head engagement, so it really helps. Yeah, I have seen this. And the good thing about it, because these are so mild and like very good, like they can be done in a very, yoga is not about the things which you see in the pictures. It's not all about shirshasana and bending and twisting. It's very much more about you it's more about the mind also. जब भी आप योग करते हैं, so along with body there are so many changes happening inside your mind, so you get a balance. So it's about preparing you mentally also. Physically तो हम कर ही रहे हैं, mentally भी prepare कर रहे हैं, जो बहुत जरूरी है. Nowadays females get panic कि उनके पेरेंट्स पैनिक हो जाते हैं कि इनको बहुत पेन है, प्लीज डू समथिंग, opt
Yeah,
for
yeah,
C-section. And I am like, this is not a choice. You should always go with the natural flow. You should, like, maybe
yeah.
you would
Whatever
be
the
the,
doctor is saying to you, you should go with that
uh,
actually.
I don't know, ma'am. You would be the one who would rightly tell about nowadays. Many people have that thing that jaan karke ya in, like knowingly there are more C-section. Doctors do it intentionally, and this is something a subject of discussion always. So you just tell people around that there are so many things that decide, like how a normal labor and a C-section is decided.
Yeah. Actually, what I feel is that if your pregnancy is running smoothly and if you are not gaining too much of weight, if you are not having less of weight also, if you are having an appropriate weight of around 10 kgs to 12 kgs rise in your pregnancy, that means some amount of it you are gaining and your fetus is around 2, 2.5 or 3 maximum at birth, then there are more chances that you will not have any problems related to a large size baby or a small for gestation age baby. Then you might go for a vaginal delivery. If some complications are added to it, the most important cause is that today the lady is not working too much and they are uh, not accepting that they might have some amount of pain. Even if for pain relief we are using epidural anesthesia, we are using safe painkillers at the time of delivery, at the time of their progress when they are going to deliver. Even then, a little amount of pain, little amount of discomfort also the women is not wanting to face, and they are such delicate, they are acting in such a delicate manner that they are so scared of the pain. They are so scared. They see YouTube, they see all blood and all the process of it. They the fear of a normal delivery is so much in their mind that they overreact at that time. And seeing that the husband of the lady or the parents of the lady, they feel that she will not be able to bear that pain. But believe me, the body has been made in a fashion in which the lady can go ahead in 70 to 80% of the times she can go ahead. But today, if the rate of the cesarean is rising, a major part of it is that the woman does not want to have even a little bit of pain, and something or the other, someone or the other person in the family, they only request us that she will not be able to bear the pain. बहुत टाइम हो गया, अब आप कर दीजिए, she will not be able to bear that, अब आप कर दीजिए. So then we are facing this problem that there are more chances of cesarean which we are seeing. So if we are saying that the pelvis is normal, we check it at 37 weeks. If we are saying that the pelvis is adequate, the size of the baby is also appropriate, there are no malposition of the fetus, the position is head downwards, it is not a breech presentation, it is not a transverse lie, if the hemoglobin and the other investigations are normal, if the fetus is not having any problem in her ultrasound, if the lady's ultrasound is showing adequate growth, the liquor is also normal, the placenta is also in the normal place, then majority of the times we will say that it is okay, be prepared for the pain, there will be some amount of pain, but we will help you in the form of some safe painkillers, some techniques in which the pain will be less, and then you will have there are many advantages of a vaginal delivery, but we have to just bear some discomfort for that.
One very common question I get from my like pregnant females, that what is better, a vaginal delivery or a C-section?
Oh,
So yeah, and they feel like what is the difference and what is better, and as a person, like it's my personal thing which I say, I would like to you also to speak about it, but I say it's not always about the choice you can make. This is something necessity. You cannot decide always that I will have a vaginal only or I can go for a C-section. It's just that if you have opted for C-section, or otherwise if you are going through a normal flow, you cannot predict. After doing all the physical activities throughout my 9 months, what happened with me was the water broke quite early. So there were not at all a single chance of having a normal delivery because there was a lot of time. Yeah, before 10 days, if this happens, so here I was prepared for something else and something else happened. So many patients ask कि आप guarantee करते हैं क्या normal हो जाएगा? Apart from that, they ask me कि क्या ज़्यादा अच्छा है आप बताइए. So you just tell that how should these questions should be, like how I can do the counseling. अगर pregnant females को थोड़ा dilemma है इन दोनों को लेके, तो आप एक बार बताइए कि कैसे होता है दोनों चीजों में, लाइक फीमेल का पार्ट या फिर बाउंस बैक करना कितना इजी होता है, कितना मुश्किल होता है.
There is no doubt that a vaginal delivery is better, but what I generally say is that there is nothing better than a easy normal delivery, but there is nothing worse than a difficult normal delivery. This means that if you are having everything normal, then little bit of pain you should bear. It will become very easy for you later on because you will come back to your normal activity very soon, and the problems related to lying down for a longer time for having a cesarean section are lesser in as compared to a normal delivery because you bounce back to your daily routine very fast. But if your doctor says that this delivery is going to be difficult, and if you insist that no, I need a normal delivery only, if the lady or the in-laws or the husband or anybody in the family says that no, we want a normal delivery only, and if I am saying, if the doctor is saying that it might be causing a problem to the fetus, then there is nothing worse than that. Because if we are struggling hard, and if the baby faces some problem, some sort of hypoxia during delivery, then this hypoxia will cause irreversible brain damage, and this is going to affect the whole family for a lifetime. So there is nothing easier than a vaginal delivery, safer than a vaginal delivery, but at the same time, with a difficult vaginal delivery, it can be very bad situation also. So if the doctor says, if there is an indication, then we should not insist for a vaginal delivery, and we should go ahead. If there is any complication, then we should go ahead for a cesarean section.
So, are there any complications? Like many females fear about, if I would have a C-section, my weight will not come back to normal. A very common thing what they consider कि शरीर फूल जाता है, and उसके अलावा we are not as good as we were before. So C-section is like, just tell me about what C-section, when a female goes through a C-section, are there any things different apart from the time of healing and bouncing back? Are there any other negative impacts of C-section for a female if she is taking good care and everything?
No. If she is having a cesarean section at a good place, then there are no chances, that there are very less chances. I cannot say that there are no chances of any complication, but same complications can be in a normal vaginal delivery also.
Yes.
There can be excessive bleeding, which can be there in a normal delivery. Even I feel that more chances of PPH, like postpartum hemorrhage, are there in a normal delivery. Why?
Yes.
Because there can be some amount of placenta retaining inside.
Yeah.
But in a C-section, there are less chances of PPH. We can control the uterus at the same time. So the complications can be in both. There are plus and minus in both. But even then, a vaginal delivery is better than a C-section. The only problem is that if the lady is very obese, if she is diabetic, then there are chances that her stitches might go bad, they might not heal properly, and she might need more rest. Then there is one remote chance that if your abdomen is opened in a C-section and then we are closing it, there are chances that there might be some adhesions inside. So they can become evident once we go for a repeat surgery for some other reason. But if it is done in a good center in which all the hygiene methods, sterility is taken care of, then there are no chances, very less chances, that she might land up into a complication because of C-section.
So what we understood, maybe with this discussion, is that we should not have this kind of view for like C-section, and because everything depends on the situation of your labor. Yeah. So what I feel, you should be prepared for both. Yeah. Either it's a normal or a C-section. If you have a good faith in your gynecologist, you should trust her and her decision.
That is very important. Yeah. Having a faith in your doctor is very important. The doctor might be a gynecologist, she might be an infertility specialist, he might be a physician, he might be a surgeon. But if you believe that you are going to a doctor, only then you should have faith in that doctor. Only then you should go and take the consultation. And if you are not having faith in it, it is said ना कि पत्थर भी जो है भगवान बन जाता है. आप उसमें बस फेथ करिए. तो डॉक्टर तो एक इंसान है, वो क्यों गलत करेगा? वो तो आपके लिए उसने इतने साल पढ़ाई करी है. आई फील दैट हम लोग अपना प्रेयर्स में ना, हम लोग अपने पेशेंट्स को भी बहुत याद करते हैं. हम कोई सर्जरी करने जाते हैं तो उस समय पर हम लोगों को लगता है कि मेरी सर्जरी अच्छी हो जाए, पेशेंट एकदम अच्छा हो जाए ना, हंसता हुआ जाए मेरे पास. sometimes
It's more like na, you are a second god to a patient, like
yes, हाँ,
because you are lifesavers है ना. डॉक्टर्स के साथ ये हो जाता है कि आफ्टर गॉड एक लाइफ होती है हाथ में, है ना, तो वो हमारी रिस्पॉन्सिबिलिटी उतनी बढ़ जाती है. तो वंस द पेशेंट हैव दैट मच ट्रस्ट, तो एवरीथिंग गोज वेरी नॉर्मल. एंड दिस इज मोर अबाउट द साइकोलॉजिकल थिंग. वंस यू are into whatever you are doing is best for me, so everything goes in a very right fashion. Yeah, I have seen this. Yeah, good. Any more questions we have?
I don't think there are any more questions now.
Yeah.
So it was very nice talking to you, Dr. Fiyonika. It
Yeah,
was
Dr.
nice.
Sumita. Yeah.
It was really nice. We'll keep on having these activities because I want to learn more from you. This art is actually we are not aware of this, and I like
Yeah.
this concept a lot. That is why I just believe in this. I even send my patients who are
Yeah.
having a lot of stress now to just go for these
Yeah.
healing therapies and all. So I
Yeah, they
generally
are actually very helpful. Yeah, and when you would be one na, who would suggest, then the patient, I will not say patients, but yes, the pregnants will be more inclined towards this new
yeah,
concept, because if anything which is new, and the only thing is we are someone who don't consider psychology and mental health as a priority. We always consider physical health as a prime thing. Either we are into pregnancy or non-pregnancy condition, we just go for blood checkups and everything, but we never check on what's our mental condition and
yeah.
psychology. So when we start understanding that it's same important as our health, we are taking our health, then it will become easier for everyone. Yeah. Yeah, you have got a nice compliment that you are the best gynae. Maybe one of your patients you have written
Thank you
it,
so
and
much.
it,
Thanks for having
yeah,
so much of faith in me. That is what I tell my patients. Only then I will be able to work better if you have faith in me.
yeah,
Otherwise, having mistrust in any relationship is not going to help at
yeah,
all. Neither the doctor nor the
yeah,
patient. So it was
yeah.
nice talking to you, Dr. Fionika. See you again.
Same here,
Bye
Dr.
bye.
Samita.
It was
Yeah.
a pleasure for me
Bye
to
bye,
be with
everyone.
you. Bye bye.
Yeah, bye.